that's our commitment, that we will continue to have that fun day every year. And what that is an opportunity to bring people together into the community, to be able to kind of see people in their own image. So that's, that was a really successful, like I say, a really successful day. Since that, we have re-established our committee, so we've, those people who want to take a step back, they have taken a step back, and we've brought 3 new members onto that committee. 4 of us are here today, and we still have our established committee members as well. But we brought Dr. Samira on. She's been involved with the charity right from the beginning, but actually now we've officially brought you in as a trustee and a clinical advisor to the team. So, we're delighted to have you. What else have we done? So we've relaunched our website, which I think is a huge success. I mean, we had, that information on the website, but it didn't have that interactiveness that we now are in a position to be able to share. So that will talk about our stories. It will be a place of reconnecting with, with other people in the community. Also, there's one of the things that we noticed, or one of the things that come through the info box, and I man that info box, is around the access to primary care, to getting past those GPs, and getting into secondary and into secondary care, but more into the clinical specialists. So we have front loaded that onto our website, so the rights and responsibilities are on there as well. So I'll talk a little bit about why I came on board. So my daughter was born with she wasn't born within 5 days. When she was 5 days old, she had her birthmark, she had a and I've got to say, as someone who works in the NHS and is able to navigate, I felt it extremely difficult to get past that private care door. We did get into Great Ormond Street at 5 weeks old, and she was successfully treated. Her hemangioma was successfully treated, but she did have some long-term psychological effects. So, that support that we have found within this support group, but also from Great Ormond Street, has had a lasting impact on me. So, what have we done? What are we going to do? What we're about to do. Sorry. So, like I say, we've re-established the committee. We're bringing on some new trustees. We've got our new ambassadors. So, Amy has been with us for quite a few years now, and we're delighted that she's staying with us. But we've brought on Lucy and Lola, and we've also brought on Dean. So, we are now in a position where we actually have a broad demographic. Whilst we don't have our broad demographics, we aim to do that. We have the male, we have the female, we have the mum, and the baby. So it's a good starting position, I think. Like I say, we've established our website, and we've also now got a 3-tier volunteering programme. So, that's an opportunity for people to get involved. So we have our trustees, we're all volunteers, and we have established roles that we have commitments around, and the governance that we need to comply with. It is not hierarchical. The next tier really is about those who want to be involved every day, like Quinn, who is heavily involved in the charity, but doesn't get a trustee just yet. Don't worry, we'll rope you in. But heavily involved in that's with the programmes of work. So there's a number of programmes which I'll speak to you about in just a moment, that we want to be able to deliver on. So those people that are more involved, but particularly in the areas where their skill sets or their interests are. And then the third programme, the people that are ad hoc, that can help out on a day like today, kind of moving tables or chairs around, or actually when they want to get involved with an element of the programme of work. But what we're all about really is we want to draw people in and volunteer with us. But what we're mainly about is making sure that we're using their right skill sets, their right experience, and their knowledge to be able to come in and fulfil that role. So what are we planning to do? So the CPD, which is Continued Professional Development, I'm trying to think what that was there for a minute. Training for our GPs. We know this is an area for primary care, across primary care. We know this is an area that we really need to work on, because this is what we see an influx of. So with Dr. Samira, which our clinician that got me here today, so Dr. Elaine Palmer, and we're bringing in Broomfield as well, Queensland. So we're going to develop that programme of work, and we'll put it out. And I work in NHS England for my sins, so we'll put it out through. We've got the channels, and this is what I talk about, those skills and experience, and I'll be able to put it out to all of our primary care practices. We're going to develop our youth programme, as I've already alluded to today, that Quinn's going to start that development, but we want to do that in And then I think we're thinking about things like podcasts. How do we start opening that debate for people and really getting beneath, some of the kind of key things that we hear a lot in our feedback as a charity. So I'll close with I suppose our values, and then I'll close with what my ask is today. But our aims is to provide a better understanding about birthmarks. So that's what we want to do, and we root that in our values. Like I've said, promote inclusivity in language and in behaviour, and we want to do that across the sector, whether it's in schools, whether it's in health. We want to make sure that what we're doing is that we are putting a positive language out there. And that finally, I think it is to promote equity and acceptance of difference in the way that we see in other conditions, if you want to call it. We're starting to see that acceptance, but I'm not seeing that so much in birthmarks just yet. So that's my aim, is to put us into that position. My ask of you today is to enjoy this event, to socialise, to get to know each other and build upon the community, and to share it on socials, because that's what we're all about. All right, and thank you. And I'm going to now invite
Germany called Professor Heppel. He says that if you see one birthmark on a baby or on a patient, examine the whole skin and you'll be pleasantly surprised. Instead of one birthmark, there may be more or there may be two, and there may be more than two. So as a pediatrician, we have learned always examine the babies and see if there are more than one birthmarks. They are very, very common. That's the message. What are birthmarks? Why do they occur? Well, here I'm just saying about the skin components. So every part of the tissue in your body can present with a birthmark. So blood vessels, lymphatics, hair follicles, sweat glands, epidermis, anything that's part of your skin can produce a birthmark. Most of them may be externally on the skin, but sometimes you get them internally too. And not all birthmarks are present at birth. They can evolve later on, okay? So they are very common, and this is why we think something's gone haywire in our genetic makeup that's producing the birthmark. And now we have evidence of genetic mutations that associate with birthmarks. So again, there was a study done in 1983 where they looked at this big cohort of patients, and what they found that salmon patches, so this is a capillary malformation on the forehead, which is very, very common in babies. 70% of white infants had this, and about 60% in the African population. So they are very common in certain groups of populations. Mongolian spots are the little blue marks on the back. Again, very common. About 95% of African infants have this type of birthmark. And of course, then the vascular ones, the birthmarks which are made up of blood vessels. So I just wanted to show you this picture. The middle picture, the center one, there is a vascular lesion on the forehead. We call them salmon patches. Very common. Sometimes you have a little bit of the redness around the eyes, you may find a bit of the neck. They are very common, completely normal, nothing to worry about. Reassurance by the GP and say this is going to go away within 2 years, 4 years, sometimes up to 5 years. But if it persists after 5 years, we should be thinking we got the diagnosis wrong. So again, this is where we should be thinking out of the box, because if you look at the two other babies there, the one on that side, where you can see a little capillary malformation there, a salmon patch, another word is stalk mark. This baby was referred to as a great almost for laser treatment of this mark. And when I examined him as a pediatrician, I picked him up and it literally slipped through my fingers as if he had something wrong with his motor function. And I thought, oh, that's a bit odd. So we asked the permission from the parents to do some genetic workup. And it turned out that this baby had a small deletion on chromosome 25. And the father had the same, because we did blood tests on the family. And we knew that when I spoke to the father afterwards, it turned out he was a lawyer, and I thought, oh, she's going to sue me now for doing the blood test. And so it's okay. He said that he was a late developer. He walked late. He started walking at 21 months of age, but everything was absolutely fine afterwards. So we try to think out of the box with birthmarks, not that it's just a small stain on your skin. There may be something more to it. The other baby has got Beckwith-Wiedemann syndrome. And what does that mean? So you may have birthmarks, but there may be some abnormalities that you may pick up clinically. So for example, a big tongue, baby that's born with hypoglycemia, meaning low sugar for a very long time, may have a syndrome associated with it. So as clinicians, as GPs, as maybe midwives, if we see a birthmark on the forehead, we would like to educate them to look out of the box to see if there's a connection to it. This is a Mongolian blue spot, which are blue marks on the back. Again, the learning point is it's very common in African babies, Chinese, other skin types. But if this Mongolian spot usually should go away by the age of 7 years, if at the age of about 2 years it's not lightening up and it's getting darker, and then there's more of it, then you start thinking, this is associated with some syndromes. And we know things like mucopolysaccharidosis, which are syndromic conditions where the Mongolian blue spot is not getting better, it's getting worse, it's getting more darker. Very quick test that we tell the GP to do is just do a dipstick with the urine where they can find proteins. So a very, very quick test. But again, sometimes we just use a bit of a Mongolian blue spot, don't worry about it, it's gonna go away. But when the parents come back and say, it hasn't gone away by the age of 2 years, it's getting worse, it's getting darker, think out of the box. So about 10 years ago, I looked at all our patients within that 2 years that had been referred to us. So it was really 2,246 patients that I looked at. I just wanted to know what sort of patients were referred to us. And it was interesting, 40% of children that were referred to us were hemangiomas, 26% port wine stains, and then 10% with telangiectasias, as you can see, a simple one with a spider nevus. And then the others were the complex vascular anomalies, where a lot more need to be done. Okay? So I wanted to take you through this paper, which was published in 2009. And if you look at the first picture, I don't know if there's a count here, look at that one. Very simple, port wine stain on the right side of the face, but same patient. If you look at the progression now, do you see it's getting darker, darker, nodular, purplish. Look at it by the third decade, more papules, lumpy bits appearing, and you can see how the progression was. This patient actually had some laser treatment on and off, but wasn't consistent. So this is why we like to treat children earlier than late, so that we can target, first of all, not just the color, but to stop these papules appearing. So let me take you to the journey of port wine stain. These are birthmarks which are present at birth. They compromise of capillaries, blood vessels, which are abnormal. And if you look histologically, the blood vessel is kind of dilated and there is not much smooth muscle around it. The incidence is 3 per 1,000. So if I am doing a neonatal ward for a year, 5,000 deliveries in one hospital, 15 children would have a birthmark. And of those, 2/3 of them would have it on the face. A third would be elsewhere, and some may have the combination of both. So these are common and they are permanent and they change with time, so that's why they are important. It's not just a stain on the skin. There are complications associated with port wine stains, and we know if you have a port wine stain around your eye, you need to think about glaucoma. These are the things that should be picked up by the physicians, by the clinicians, by anybody who's in the medical profession to say, oh, you got birthmark on your eye, we need to get the ophthalmologist to check you out. If you have a birthmark on your forehead, like you can see here, so there is a condition called Sturge-Weber syndrome, where you can get birthmarks within your brain. And then if you look at that list, there are a few other complications that are associated with the birthmarks. So when we have children that come to us, we have to make sure that we got the right diagnosis. Because we can get it wrong sometimes ourselves. It's really important to know that we are dealing with a port wine stain and not something called arteriovenous malformation or not something different. So we go through, as I've said here, when do we start laser treatment? Make sure that everything else has been done. Patient has been checked by the ophthalmologist, because you can see here what we call clouding of the cornea. This baby has already got glaucoma at birth. If there's birthmark here, think about Sturge-Weber syndrome. If you got a birthmark around your lip, think about hypertrophy. Think about what I showed on that paper. There's a progression of birthmarks. So it's really important to make sure that we get it right. So the next slide is really to show you a patient whose mom was one of our members of the BSG. She was part of that early development of the Birthmark support group. So her daughter has a port wine. She must be now, I don't know, 20 years old. So she has a port wine, as you can see. She was referred to me from Hillingdon Hospital for laser treatment. In those days, we were doing very early laser treatment. So I did a test patch on her forehead. All happy, everybody, they went home. They were supposed to come back to show me the result of the test patch. A month later, the consultant from Hillingdon Hospital phones me to say, oh my gosh, your test patch has caused baby to have an epileptic fit. I thought, oh my God, what have we done here? But obviously that was not the point. This baby had what we call frontal cortex abnormality. If you look at the MRI scan, that part of the brain is shrunk. There is what we call PL glioma, which is calcification of the lining of the brain. And children can present with epileptic fits on the opposite side of the body. So we are now trying to pick this up much earlier on than waiting for the children to have an epileptic fit. At Gosh, we have Sarah Aylett, who is a consultant neurologist, and her team who look after these children. So if we suspect a baby having possible Serge-Weber syndrome, we refer these children to her. And many of these children go on a small dose of aspirin to help stop the epileptic fits, plus all the anticonvulsants that may need. Okay, so it's laser therapy. Many of us are having laser therapy here. My consultant is here, who does my laser treatment at Chelmsford. So here we are. So when patients are referred to us for laser treatment, we do not say, oh my gosh, you have got type 4 skin, we're not going to do your laser treatment. We work with them to see, is laser going to work for that skin type? Sometimes even type 6 we laser, because we may make a difference if they have got any papules or the color is purple and very dark. We will select conditions that respond to laser. Those with the facial port wine stains where we know that it's going to cause visual difference in times to come, we would offer them laser therapy. Some of those patients who have little blebs, we may just target those because the birthmark may be very big and large. And the children who have got Sturge-Weber syndrome or any associated syndromes, we do not say, oh no, we're not going to laser you. If we think it's going to benefit them, if we think we can make a difference, we will work with them and we'll offer them laser therapy. This was one of my very good outcomes of a child who only needed 2 treatments. But sometimes we need 4, sometimes we need 6, and it can be 12, even up to 20 treatments as time goes. So this was Sophie, whose parents, Tony and Mark Lingfield, were the first people who started the Birthmark support group at Great Ormond Street. Was it 29 years ago? So her daughter had a port wine stain, and she had a story to tell, so she published it in one of our Gosh magazines. She did well, but again, she was one of those children that we picked up very early on, that she had something extra than just a port wine stain. So she had muscular dystrophy. So it just shows you need to think about out of the box. They still remain very close friends with us at Gosh. Having done the laser treatment, you say, wow, you've done well here, it's all nearly gone, 80% improvement. Does it come back? So it can come back, and the reason why it comes back is there are deeper birthmarks, which in a baby may be a bit dormant. So as the child gets older, those blood vessels start to resurface, and then they become like a recurrence, or we can visually see them. In our series, when we looked at it a long time ago, I think it was 2007, our children had like 10% recurrence. But then as we followed them up, we think about 20%, but some series say 40%, some say a bit more. I think it all depends on what technology you use for lasering. So this is one child, as you can see. The test patch was absolutely brilliant, as you can see at the bottom picture there. I thought, wow, fantastic. Lasered him, very good, 6 treatments, nearly cleared. At 10 years of age, when puberty started to kick in, the birthmark started to come back. So we lasered these, and we're now using a bit more stronger lasers to see if we can improve them. Again, when I mentioned about why we think there is recurrence, we do know that the blood vessels are different. So some are very superficial, like I've shown here, just little blebs of capillaries. some have what we call matchsticks capillaries. So you have a blob and you have a line. So they are type 2. And this was described in this paper on a capillaroscopy. This one is what we call slightly venular lakes. So they are dilated blood vessels which have got blood in them, so they are a bit more prominent. They may be underneath the skin, so target may be not as easy. And now we know there is type 4, but type 4 capillaries which are much, much deeper. And we can't pick them up on MRIs. We can pick them up capillaroscopy sometimes. And I've been using cystoscope, but the cystoscope only goes deep to about 2.5 millimeter thickness from the skin. So it doesn't go deep enough for us to pick those. Okay, so I think there are different types of birthmarks within the port wine is because of the capillaries. Okay, so we do get side effects with the laser. When we looked at this 340 children, our series showed 8% of side effects. However, that has improved in our hospital because now we standardize lots of things. We've got WHO follow-up. Every patient, we go through the list to make sure that the skin is okay, they're not suntanned, there's not been any trauma, and then that way we have reduced our list of side effects. Okay, so that's port wine stain. I just wanted to touch base on hemangiomas, which are very common. 1 in 10 babies have them. They are the most referred patients to GOSH. So the referrals keep coming. Okay, some of these hemangiomas are extremely challenging. Some are misdiagnosed. Some present with ulcerations and bleeding, and they can be very, very painful. And some are associated with syndromes. So the one I showed you, which was a very simple one, but again, if that started to bleed or ulcerate, then obviously it would cause a lot of trouble. This baby had an ulceration on a big hemangioma, which I think this baby before was referred to as had already been to theatre about 3 times. For them to clean it, to debride it, to, they tried everything they could, but then obviously it just got worse. So the first thing we did was we gave analgesia. Then we take a little swab to see what organism is grown from, because that's really important. We target the bug, the organism that's grown, and that way you can start healing the hemangioma better. Obviously now propranolol has come on board, and many of you know about propranolol, so we would start with treating them. So in our series of children, I looked at 107, and the common bug that was Pseudomonas, which is a real nuisance bug. If you look at the organism, it's got a double capsule, it's really strong, so you can't break it, even sometimes with antibiotics. So it's important to know what organism is grown on the ulceration so that we can target the treatment for them before we think about propranolol, before we think about laser treatment. So of course, 2009 in France, there were, I think, 2 babies with cardiac problems, heart trouble. They were put on propranolol, it's a very safe drug for heart conditions. And the French doctors noticed these 2 babies had large hemangiomas on the face. And what they noticed, it was treating their cardiac problem, but it was also shrinking the hemangioma. So this is how the propranolol came about. And of course, when I think we were at a conference, we heard about it. So Professor Harper said, right, we must get on top of this. We came home, we had about, we picked up 32 children with hemangioma, started them on propranolol, and hunky-dory, it was really good. It really helped. So it's changed the story of hemangiomas. And then we published our paper about the role of hemangiomas. This is one patient of mine who was on propranolol at the age of 5 years. He was still like this. We went ahead and did some laser therapy with a very good outcome. Okay, we treat many other conditions, and there's a huge list here, as you can see. I'll just skip through those. And then that 24% of others in my series are the venous malformations, the lymphatics, and so forth. So this was Bethan Slater, who was 5 years of age when she was referred to us as a CMTC, this is another dermatology condition. We looked at it and thought, no, that doesn't sound right. And genetics were just coming on board. So we sent a biopsy from her lesion to where was it? I think Holland, and this was our first baby that was found to have a genetic disorder called glomerulin gene defect, which is present in some of the venous malformations. And then, of course, you know, she was treated with various therapies, and the laser came on board, and she did really well. So just a quick assume about her, that she was 8 with lots of, you know, these were all present at birth. They were all over her place on her body. They continued to appear, and there was a family history that was, I suppose, in a way, a giveaway. 3 generations of children, 3 generations of family members who had similar lesions. So then, of course, she came on board with the Birthmark support group, and you know, we wrote about her, and she was until recently part of the Birthmark support group. There's another child from Scotland, Carmen, who's having laser treatment for her GVM, glomerular malformation. We treat other things, as you can see here, varicose vascular malformation. We've just written about our series over 30 years, it's been published. Rare condition, but we can make a difference. Sometimes you have to do a bit of surgery with it on areas which are persistent. So combination treatment with our plastic surgeons, we can do that, okay? So finally, we write a lot of booklets for families, we publish, we write leaflets for children, for mothers, for fathers, so that we can give information. And Lisa was another of my patients who one day presented us with these pros and cons of having a birthmark. It was a really nice little story here. Okay, and then, of course, we have strong affiliation with charities. And I participate in 4 of these charities now. One is from home, Tanzania, where I was born, the Skin Care Foundation. We do a lot of work with them. But of course, Birthmark support group is on top on the list. Okay, what is the future direction? We've already heard from Granny this morning about what we want to achieve. It's really promoting awareness on social media and elsewhere, like attending events like this. And with that, I would like to say thank you very much for listening to me.
Plastic surgery aspect, the laser aspect of it, and I have children who are proud of their birthmarks, who are proud of their burn scars. I have a lovely child who came along with the parents who were worried about the hair loss that looked like a lightning strike, and she said, everyone says how cool it is that I have a lightning strike in my hair, you know, and she wanted nothing to do for it. So we're not here to change you, we're here to help you if you want to. The reason why I have so much lasers and so many things to do in little old Essex in Chelmsford, where we are based, is that we are the National Burn Centre. And as the National Burn Centre, we cover the whole southeast of England and patients from here and abroad. But that means I get money for lasers. Because as we'll be talking about, and one of the points of raising this today, is that there is discrimination regarding funding for birthmarks. but it means that I've already got the lasers from the burns route to be able to treat birthmarks. For those who are around here, you probably know that the burn centre's up the road. We're the National Burn Centre, because in the olden days, if London was to get bombed, they wanted the burn centres outside of London, which makes sense. We're one of the biggest burns and plastics units in Europe, with 30 plastics consultants and 40 juniors. We in the laser suite have 2 laser rooms, small but perfectly formed, and around about 25 lasers, and we do around about 18 to 20 cases a day, 5 days a week, sometimes 6. On a Tuesday afternoon, you think it's all me, but it's not. We also have a vascular anomalies clinic, which we link up with Paul Morris and Loshin Kangesu. Now, these are very eminent names in the world of vascular malformations, but they also link down with GOS. So we have great ties with GOS, and this lady here, yeah, even right now, she said she didn't want to be noted. Tara Mack, my senior laser practitioner, is over in the corner, but as usual, as you can see even on the slides, she's in the laser room whilst we talk. Okay. What do we treat? We treat everything that can be treated with a laser, okay? Because the money comes through from the burns aspect of it, we use that to treat patients of every kind of skin type, ilk. And mainly we get referrals from GOS when they come up when they're adults, or if they're children and they're local. The main thing I will say is the skin is easier to treat when it's thinner. When it's thinner, yes, it was when they're younger, but sometimes they don't get to us till they're older. I will show you some pictures. Again, a bit like Samira, I've got loads of patients who very kindly said that they'll have their photographs looked at, but not for TikTok. Okay. Although some of them are very famous people, but I haven't included their slides today. So what I will show here is that we do have many different modalities, but it's a bit like iPhones. The first iPhone did its job, but not very effectively. We're now on iPhone 17, I think my children were telling me. Yes, it does everything a lot better than the first iPhone. So technology evolves, but unfortunately the NHS capabilities is not to buy a brand new iPhone every year. Okay, so I'm very lucky in our institute that we seem to get everything, but it's again from the burns aspect. We use a lot of pulse dye laser. The pulse dye laser is a short wavelength, gets absorbed very superficially. Hence, if you've got thinner skin, it's more likely to be effective when you're younger. We also use something called a 1064 wavelength, the Nd:YAG, which goes a little bit deeper. But sometimes I change problems from things that I can't treat into something that I can treat. And by that I mean, the older we get, the thicker we are, the more that you might actually have capillaries and vessels underneath causing a mass coming out, I might cause a burn. So, in children this is not desired, yes? But in adults, sometimes if you go, right, well actually I've got a big mass on my face and it's grown out, I've got to change it into a burn, and I'm a burns consultant, so it's a problem that I can deal with. Okay, so as we're saying, sometimes you've got to cut things out to reduce mass, sometimes you've got to burn things out. This is a lady with a burn scar to her neck, which we've effectively treated with a couple of sessions of pulse dye laser. That's us 3 doing our different modalities, and indeed we've got a pico wave laser, which is even faster, so nano wave lasers, pico wave lasers, etc. There's about 1 million different ways. The one thing I will tell you is you are all unique. Yes, so we have people come around to us all the time and say, can I copy down your settings? These are, pardon my French, idiots, okay? These are people who will say, I will do exactly the same settings or do a drop-down menu on them, the laser they've bought, and I'll show you the reason why I say that in a second. So we've now got lasers that fire very, very quickly, and therefore, if the quicker you fire, the less you get the collateral damage. I apologise for the children in the room. I didn't know how many nasty looking slides to take in and out. This is the child that was burnt somewhere else, conservatively managed in a lot of pain, and as you can see, absolutely terrified, with big, thick red, so vessels, network of vessels, which capillary malformations and scars are. and needed to come have a general anaesthetic. This is him after a couple of sessions of pulse dye laser. Okay, pulse dye laser, very effective. We also sometimes use CO2 laser to make holes, to get deeper, to deliver things, to settle down. Okay, and he was happy. Now, the thing that's also interesting with us is that we will treat children. The more times, the way I treat like blood vessels, we talk about arborization, big vessels down, the tree trunks at the bottom, and the branches that come up the top. The more times you treat, the better suppressed it is. Unfortunately, you can't give a child a general anaesthetic every 6 weeks to do maintenance. So we, in our setup, and it's different in different setups, treat children as young as 2.5 years of age, wide awake, no problems. But that is because we're well set up with, it will take an hour, and if the child says they don't want to have it done, for whatever reason, they are the boss, okay? We have, again, a bit like Samir, we have kids who fly down from Glasgow and around the world because it doesn't get funded. And exactly, we say, I'm really sorry, I know you've flown into Stansted and you've taken the day off work, but if the child, for whatever reason, is not feeling it that day, we don't break your trust with them. This is his flanks afterwards, and as you can see, the usual spotty appearance, and that's him afterwards. And what we've noticed now with burns, and we've published it, but we've always known, is early laser works better. So that's for virtually everything. These are the kind of cases that we get commonly up with us, which is, ladies usually quite good, the men are not. Men usually leave it far too long before coming and getting something seen. I apologise. But it's true, we go, oh, it doesn't really matter, I've lived it for most of my life. But actually, it is these nodules that start forming. Okay, so the vessel is there and it's starting to deform the skin and form nodules. So actually, then we use a harder hitting 1064 laser to try and get rid of those nodules and suppress them. I thought I'd talk about some of the other conditions that we treat with. So HT, Oslo Weber-Rendu we treat as well, and that's after just one session. We also, and this is one of my favourite ones, but we couldn't get her pictures in time, but nevus avota, which is melanocytic deposits around the side of the face. This is roughly what she looked like beforehand, and that's, hopefully you can't see much on her face afterwards. So the before is not her, but similar, because I couldn't get her pictures. But again, this is life-changing. Again, we've got a child who's come down from Glasgow, flying down, because again, children point and stare, and they say things like, have you been hit in the face? And we've a bit like Mongolian blue spots, which we have issues with. They come to see us as experts and say, can you say that every time I go to hospital child, I haven't abused my own child? We treat a lot of melanocytic nevi. Whether you can truly get rid of them, this is the point for the British Medical Laser Association, but what we can do is we can make it manageable. For like this young lady, she didn't want it being thick and hairy, she wanted a plain area just to put makeup on. Yes, she didn't want hair growing out the front of her face, and so from her point of view, she was happy. So this is sort of our motto in the laser room: go big or go home. So it's all about the little gains adding up to the big gains. So this is one of my favourite films for. Well, there might be some older people in the room reference. So you make all the little gains adds up to one big gain. So this is us in laser theatre. So what you will see is we will have two lasers going at exactly the same time, which when we started doing it gave her very big heebie-jeebies, because Tara there is our laser safety officer, but she's in on it now, so she can't complain about it. This shows you what the power of lasers can do. And again, the reason why I say this is textbooks, online forums, everything. You need to educate people, because lasers traditionally didn't do much. But a bit like the iPhone analogy, the newer iPhones can do more, but the books don't get published for about 4 to 10 years. So you'll have someone, like even my juniors when I examine them to be consultants, come along and say, ChatGPT says, and I go, ChatGPT is an idiot. You put rubbish in, you get rubbish out, okay? So you've got to be very careful. So this gentleman had been around for around about 20 years. This is as high as he could get his arms up. That is his arms, 10 photographs later with CO2 laser. Of course, all the doubters around the world then said to us, he won't maintain it. But actually that was his arms up there, and that was his arms all the way up. And he's maintained it for you, and he's a big advocate for lasers and helped some of the units in the south get lasers. And what he has said is, after all the operations, so the things where I used to cut him, yes, after all the years, one GA laser session has made the biggest difference to my life. And it's not just Roger, we've got our other two advocates for us to get lasers. And it's back of it, things like this, you know, you get support. But I want to come along here for the last bit and just talk about two roles that I have. I'm a burns, I'm a laser and a plastic surgeon. I see people out of desperation going to people from Instagram, TikTok. It is not a qualification, because you might not have funding, and I think this should be funded, yes, 100%, but it's not regulated. So I see, at the BMLA when we were there last time, some people said, let's get rid of test patches, we never see any complications. And Mr. Frew sticks his hand up in the air and goes, I see them, I see a lot of them, there's lots of medico-legal cases. And that's the reason why I don't want some of these filmed, yes? But I want to put it there to emphasise, because out of desperation for yourself or your children, you might go to one of these people who claims to be really good, yes? This is a lady who had just a little bit of red on her face, had a bit of IPL put on her face, and burnt, medico-legal case, scarred. This is tattoo removal again from a well-known Instagrammer. The person on the other side I didn't point out actually died as a result of his wound from a tattoo removal. This is a lady who went to a beauty aesthetic place, well run. I've got to say, if someone's running something, an extension of their house, yes, please don't go there. If they're doing in a hairdresser's or high street, even the high street chain, please don't go there. Okay, there is a reason why professionals like ourselves exist. This is even something called a hydrofacial, which again is very much in vogue at the moment. Boiling water, scarred permanently over the face. And this was actually a consultant colleague's wife from St. Elsewhere who phoned up and said, Mr. Frew, I'm really sorry, I know what you're going to say to me, but can you treat my wife? I said, why? And he said, she's had a hydrofacial and burnt her face. I said, who did it? Instagram. He said, Mr. Frew, I know you're disappointed at me. So please, 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 come contact us, either NHS, private, etc. But what we want to talk about, and this is the sad thing, is pre-COVID, we didn't have a problem really with funding. Post-COVID, I don't know what's happened to the NHS, but funding is now a major issue. So for me, if you're already in the system, I can treat you. If you then leave the system, like some people go, listen, I'm static, I want to, and I go, no, just please, keep me on your books, see you in a year's time. Because once you're out, they'll say your treatment is finished. They will come to us managers now and look at the papers and go, well, it takes 6 to 8 treatments. But a bit like this child comes back with the forehead, many years later you need to carry on and do it again. So please come consult us. This is us, we do NHS and private, but this is the main thing is, look natural safely. You are wonderful. Don't let anyone else tell you otherwise. Okay?
anxious first-time mum. And I think over time, after speaking to lots of parents on this journey, I've realised that that experience is not unique at all. And many parents that I have spoken to, similar to us, are facing lots of delays in treatments because hemangiomas are very much misunderstood. And a lot of the concerns, I think, in the early days are brushed off as if you are kind of concerned solely about appearance, which was so far from the truth. Lola was about 6 weeks old on these photos, as you can see here, and I finally took some advice from a mum that I'd met on social media who had been through something very similar. And we went to A&E simply because of the trouble she was having feeding. She wasn't able to put the bottle in her mouth without her screaming in pain. It was during COVID times and I had to go alone, which is obviously very daunting as a new mum. But I think that day was the day I decided to trust my maternal instincts, and it was the first day we really took the step into getting her some serious help. Now, within those first couple of hours of waiting at A&E, we immediately saw paediatricians, dermatologists, plastic surgeons, all of who reassured me that I'd absolutely done the right thing coming in, and if anything, I probably should have come in a lot sooner. From there, we spent 8 nights at Leeds General Infirmary for lots of tests and monitoring before starting propranolol, a beta blocker that I know many of us here may know well. Beginning such a strong medication at only 6 weeks old was very overwhelming, especially making those decisions on my own in COVID times. But it was very vital in helping her to heal her painful ulcerations. We met with Dr. O'Hare, which was her amazing consultant, and he confirmed how much pain Lola probably had been in, which was very heartbreaking as a mum, but very validating to know that I did the right thing by trusting my instincts. Lola's journey with her propranolol medication and appointments carried on until about a year ago, and she's recently been discharged. Her journey is on pause at the minute as she grows, but I know it's very much far from over. What I really wanted to come here today to just speak about briefly was just highlight how I think things could have been very, very different if I hadn't trusted my maternal instincts on that day. Instincts that I did very much doubt at the time. I was fortunate to find some help via a community that I'd created online, but I know that there's so many parents out there that have not got that and haven't in the past had that as well. I think in the early days in particular, the language that was used by the GPs was quite damaging for me as a new mum. It made me question myself a lot, and it added the guilt that I already had of not really knowing what to do as a parent of a child with a visible difference. And I think it often, in those first kind of 5 or 6 weeks, it left me hiding away rather than going and seeking the help that I needed to kind of go and get. It was repeatedly suggested to me that my concerns were only about Lola's appearance, which was very upsetting and so far from the truth. And it made me feel very ashamed, as though people thought that I didn't like the way she looked, which again, is very, very, very far from the truth. I just simply knew something wasn't right in that moment, and what I needed in those early days was reassurance and guidance and support, but instead I ended up feeling completely alone. Being told over and over again in these early days that these birthmarks would disappear by 18 months old, again, was very damaging, and it was something that the NHS website did state at the time when I was going through this. It has actually changed on the NHS website now to 7 years, I think. But I think it's really, really hard to give a time frame as well. I think it's impossible to predict the timeline of a hemangioma. But for me, I think as a new mum in particular, to be constantly told that this birthmark was something that would be gone and almost like it had to go, something that wasn't acceptable as it was also very damaging and very confusing. And I think it's that kind of language that really, really matters. It shaped how I saw the situation, and it added guilt that I didn't need, and I think it made me feel a lot of pressure to get rid of this birthmark rather than reassurance and thinking about how we can help it. I think the words used by those professionals can have such a lasting impact, and I know that they did on me, and all the right words in those moments can make such a difference. I know my experience, and from speaking for a lot of parents, it just shows how little awareness there is around the complexities of hemangiomas, and as we've seen through the slides, they can become quite complex. And I think just with a better education things like these early referrals could be made sooner and treatment could be started quicker, especially in cases like Lola's where hemangiomas were growing and ulcerating and obviously the child is in pain. Too often I'm chatting to parents and they are not being directed to the right care at the right time, just simply because of a lack of understanding. I want to come here and highlight how, for the majority of Lola's journey, we have been incredibly fortunate. Dr. O'Hare in Leeds, hemangioma specialist, he was amazing. Under his care, we've been treated exceptionally well. We would no point question about anything about her parents or anything. But what I've been understanding through working on social media with a lot of parents is that our experience is actually really, really rare, and many families are contacting me, as I'm sure they're contacting the charity, to share really distressing stories. They're not only being questioned by strangers every day, which is bad enough in itself, but also by medical staff about the child's face. I think birthmarks are being frequently mistaken for bruises, burns, and often abuse. And children and parents are getting asked some really hurtful and inappropriate questions like, what have you done to your face? Which I'm sure lots of people have heard here. And a lot of the time not even checking medical history. These situations aren't just distressing for parents, they affect the children too. Now Lola's just turned 4, and I'm only really now beginning to understand how damaging these interactions are for children. Now Lola can understand and what people are saying. I think children like Lola are facing stares and questions and second glances in everyday life, but I think to go and experience that same kind of thing in a medical setting, where I think you enter medical settings with a certain level of expectation of what kind of compassion or understanding should be there, it just feels wrong. An experience that happened to us just 2 months ago, we visited our local A&E because, like many toddlers do, Lola decided to stick something up her nose. So it was completely unrelated to her birthmark, and we were waiting for hours and hours and hours, and the first doctor rudely asked in front of Lola what's wrong with her face. And to see my daughter look very sheepishly at the floor, fully understanding not just the words she was saying but the tone, was really, really heartbreaking. I think that's the first instance that I've ever noticed that Lola's really understood how someone is speaking to her about her face. I, as her mum, explained and tried to move on, but then we were asked the same question again by another ENT doctor later on. And it was really shocking, and I left there really upset. Not just kind of the lack of bedside manner, but just the lack of understanding of birthmarks and the poor communication as well between the staff. I am an ex-primary school teacher, so I completely understand the need and the importance to safeguard children. And I even understand that if you are not familiar with a birthmark, it may look like a bruise, it may look like a burn. And I'm always very open, hence why I'm here today, to having these conversations with anyone I meet. But just as I try and kind of use a social media platform to encourage the public and parents and children to approach these situations with empathy, I'm here as well to urge kind of healthcare professionals to do the same and meet these families that are coming in with grace and compassion. I think it's really crucial to consider how we can talk about visible difference in ways that can protect the emotional well-being of these extremely vulnerable young children who can be shaped by these experiences for the rest of their lives. For 4 years now, I have worked tirelessly at home to teach Lola about her birthmarks and her body, and I strive at home to create a really inclusive, positive environment where all differences are normalised, not just birthmarks. We role-play conversations that she might have to have with her peers or strangers, which is something you don't expect to do anyway, and just try help her develop her confidence. I know so many parents that I connect with do the same. But since I've shared our hospital experiences online, I honestly received hundreds and hundreds of comments and messages of parents who've been put in the exact same situation again and again. And their worry was all the same as mine, that all the confidence and all the positivity that we work as parents so hard to instill with our children can be undermined in an instant just by one thoughtful comment, a rude question, or just a very insensitive tone. And you can see some of these, I don't know if it's going to scroll, but you can see if it scrolls how many comments there was. So I wanted just to come here today. I'm not here just to speak on behalf of Lola and myself, but for all these parents who continually message me and we chat and who have reached out about their journeys as themselves. the challenges that these parents that I speak to are very, very rarely about how they see their children. It's about how the world around them sees them, and it's the exhaustion of constantly explaining, the sting of the stares and the second glances, and the guilt triggered by these careless words, and that come in sometimes a shock form when you are in front of medical professionals and you don't actually expect it. I'm not standing here, I mean, if you think this might be the wrong crowd for this next line, I'm not asking anyone to become a birthmark expert, even though I'm sure most of you in the room are, but I'm not going and trying to preach everyone to know everything about it. That's just impossible. But I'm just asking people in this room and in general that we just pause and just consider how we can just engage sensitively and age appropriately with children and any individual with a visible difference. How we can learn what we need to know as a medical professional in that moment, for instance when I went into A&E with Lola, without making someone feel less than or that they aren't normal. I think that kind of thoughtfulness can make all the difference to a family's experience. So I just want to say thank you for listening, and I just want to leave you with a thought about Lola and how her experiences so far in life have definitely shaped who she is as an individual. She's very resilient, and it's definitely shaped who I am as a mother. But it's not her birthmark itself that's going to shape her world for the rest of her life, but it's how the world around her and the people around her see her and speak to her and support her. And I just think every word, every tone, every glance can really leave a lasting impact on these children. And I just want to urge everyone here today and everyone that I meet just to consider the power that your words really have, and how just one moment of understanding and kindness can make the world of difference to these children. And I think if we do this, perhaps fewer families will be messaging me with these situations in the future. So yeah, thank you.
We are running a few minutes behind, but lunch is coming out. But while we wait, we're going to welcome Amy up.
Do I just press that? What do I press? Hi everyone, so if you don't know, I'm Amy, and I am a model, content creator, mother and advocate, and today I just want to share my story about difference, struggle, acceptance and ultimately empowerment. So when people look at me, the first thing they notice is the birthmark on my face, which is a port wine stain. And for many years that stain wasn't just a mark on my face, it felt like a mark on my identity, something that would fill me with anxiety through having no makeup on or general hospital appointments. So just a little bit of background in childhood. So I was born with a port wine stain on the left side of my face. It's part of who I am. Growing up, I became acutely aware of how others perceived me. By the time I was around 4 years old, which is when I drew that self-portrait, I knew I was different to other children. Other children would point and stare, call me ugly, names like blobface, ask me what I've done to my face. I even had strangers come up to me and say things like, "You'd be pretty if it wasn't for your birthmark." So I started laser when I was 3 months old in Bromsgrove, which is a 334-mile round trip every 6 to 8 weeks until I was 2 or 3 years old. Then when I was 5, I started laser at the LGI in Leeds until I was about 10. So this was a very traumatic time. My mum couldn't take me anymore because it was just traumatic for her. My dad had to do it, and eventually at the age of 10 the laser wasn't improving anything, so then I stopped.
and my parents just didn't want to put me through that anymore. But then in 2019, I was approached by the BBC to be involved in a documentary which followed me getting laser treatment. And then since then, I've been having laser treatment at Salford Royal in Manchester every 3 to 4 months, bar a few breaks during COVID and pregnancy. When I was about 11, when I started secondary school, that is when I began using Veil Cover Cream, which is a camouflage makeup that may have been prescribed to some of you by the NHS. That became my protection and my routine. There was no social media back then. There was nobody that I could look up to be like. There was nobody I could ask for makeup advice, and I felt like I was the only girl in the world who looked like me. My coping mechanism was just to wear makeup and just pretend it never existed to the outside world. Living under a mask was not only exhausting, but physically, applying makeup, touching up, emotionally I spent so much energy worrying, will people stare at me? Will they judge me? What if my makeup comes off? What if it smudges? I felt trapped by fear and shame. There were days where I'd think, maybe I'm less worthy because I look different. I carried that internal weight for a long time. The negative words, the stares, the constant self-doubt, they all chipped away at my confidence. Until one day I reached a point where I couldn't keep hiding. I remember asking myself, I wish there was a way I could get my face out there so I was no longer hiding. Then, in 2014, along came the Cancer Research No Makeup Selfie. And I thought, this is it. This is my opportunity to get my face out there. And I posted the no makeup selfie and I wrote, not going to lie, taking a no makeup selfie fills me with dread, as I would never leave the house without cover up on, as I'm scared people will stare at the birthmark on my face. So uploading this into Facebook makes me feel quite scared. But I thought, no, I'm going to do this. I'm not any different to anyone else. This is just the way I was born. I've got nothing to prove to anyone else. This is who I am, and this is for a good cause, showing cancer awareness. I was terrified, but I also felt maybe this is the moment I start being honest, not only with the world, but with myself. The response I got was overwhelming. My post went viral. I got support from all over the world. People messaged me, told me that they admired my bravery, shared their own stories with me, and told me how I'd given them confidence. That moment didn't magically erase all my doubt and fear, but it cracked open a door. It allowed me to begin believing that I can be myself with or without makeup. I didn't need to hide who I really was. I didn't need to carry this burden anymore, and it felt freeing. It also opened doors for me in modelling, media and advocacy. I've been on the local news, BBC body positive campaigns. I was on Katie Piper's Face to Face. I have been on the BBC Skin documentary, modelling on QVC, and then I was signed by Zebedee Modelling Agency. And this has meant I can work with brands and get birthmarks represented, and finally being able to be that girl for people I never had when I was growing up. Now I use my visibility to encourage others and see beauty beyond conventional standards. So here's a few things that I've learned. Difference is not a flaw, it can be a strength. When it comes to negative comments, I think of my birthmark as a barrier against unaccepting people. It is, if someone's going to say something mean about how you look, that's a them problem, and it says more about them than it does about you. When we let go of trying to look perfect, we free ourselves and live more fully. Other people's perceptions lose their power when we start believing in ourselves, when we believe in ourselves first. We all have stories, scars, marks, and visible or not, that shape us, and embracing them can become a gift, not a burden. Wearing makeup doesn't mean I'm covering anything up, it just means I like switching things up. Some days I go barefaced, some days I go full glam. I'm comfortable in my skin either way. It's not about hiding, it's about having fun, knowing I can have two looks and both are me. Makeup can already just exist, makeup can just enhance the beauty that already exists. My mission is to help make visible differences feel normal, break down beauty stereotypes and be a role model to anybody who's ever felt alone because of how they look. I want people to know that your story, your face and who you are really matters. So today, whether you have something visible you've hidden or an invisible struggle that no one sees, I want you to remember that your voice matters. You deserve to be seen, accepted and loved for who you truly are. So I challenge each and every one of you in the next week to do one thing that leans towards authenticity. Instead of hiding, speak your truth, show yourself. You never know who might see it and where it might lead. So this is a reminder that our skin tells a story and every mark makes us unique. For me, it's about embracing confidence, spreading understanding and showing the world that beauty comes in every shade, shape and spot. You can achieve your dreams no matter what you look like. Be proud, be bold, be you.
The agenda just a little bit, so to allow everyone to go for lunch. So lunch is now served if you want to make your way over and get something to eat.
that's better. Stain, just get rid of the stain for now. We'll work on the other bits after. That's fine, cool. Yeah, I'm good with it. Yeah. That's. And also, port to port means left, which is really. I'm left. Yeah, which is great. Yeah. So I'm gonna go, like, being a kid, I actually got nothing but fond memories as a young kid. My mum and dad were super supportive. They're the sort of parents that if I went to the beach, they told me to rip off my top and not care about it. And I think that's given me the attitude through life not to really care through the most part of it. We didn't have, oh, that's part, I forgot to do the port wine stain bit. No, that's what I was gonna, yeah, that's a port wine, there you go. We didn't grow up with a lot of money. We were really, really poor. This is a bit what you feel sorry for me to make it so much better. And it was the 80s and 90s. There wasn't any social media. There wasn't anything at all. So I honestly felt like I was completely alone, which is obviously a resounding theme we're hearing from everyone, which shows how much work is needed to be done here. And also, fate wasn't quite done with me there. When I was 3 years old, my gran was carrying a kettle with some. Oh, that's like no, keep it down. Kettle and some cups of tea, and I ran in front of her. I got burnt on the arm. I got 3 third-degree burns. I would have made you a lot of money. I've got a handprint to show for it still. But again, my parents just said, "Don't care about it, carry on." Which I'm now at my age, I'm so pleased they did. Infant school. I don't really remember too much of it. I'm too old now and had such a great time in my 20s. I don't really remember too much of it. So that's. I don't have many bad memories at all. Junior school. It didn't start well. My first day, I remember moving from New Haven to Salisbury, and I had my first day at school. I was really nervous about the birthmark, so I wanted to make sure everything was going to be all right. My parents were really great. Went into class, settled down, and wet myself. So that was brilliant. Got sent home. Had to start again. Went in the second day, and dust yourself off. Don't worry about that. Come above. Went out for my break, tripped over, knocked myself out, and I was off again. So like, I didn't want any attention. It was never gonna be that way. And that's kind of one of my first bits. Is kids are nervous anyway. It wasn't really about the birthmark at all. Teachers and parents kept pushing me on all the time, which I felt was great. Because kids are going to grow up. We are going to be part of society one day. Even when they feel really small here, trust me, as a dad of a 17-year-old, it goes so fast. And giving them that confidence to be proud of themselves, I think is really important. And the sooner you help them build strength and confidence, the better. And that's not just for kids with birthmarks, that's for every child. I think every child needs the same, Junior school wasn't too bad. Got a few names started to creep in. I had one fight over it, that was it. I got a load of fond memories. I was, there it is, junior prefect and sports captain. I don't know if that was because I was any good or whether they were just trying to make me feel better about myself, I'm not sure, but I got the badge to prove it, which is cool. And my mum helped me a lot with that and put me into sports. I ended up doing quite well and playing for I represented South England and doing stuff with Umbro and all sorts, and I think that gave me another confidence boost because I felt good about myself on the pitch and stuff like that. It was the teenage years, which is where I'm getting to now. The teenage years were definitely harder, and I think it is for everyone in general anyway. And I didn't have many photos. I asked my mum before this if you could find some old photos of me with my birthmark out as a teenager, and this is sadly that's the only ones you could find where I'm not putting my birthmark over my sleeve, which is a bit depressing now because of how I feel now. Yeah, there you are. That's the last 3. I can't blonde I was. So yeah, I was always putting my sleeve over my jumper. I learned very quickly that having a quick wit and being able to laugh at yourself a little bit is really essential. School came with quite a few nicknames. I was called Beetroot Boy, Burn Boy, Redneck. I mean, if they were really crap at coming up with names, it was just Freak, which is like the most fun, but I got called pretty much everything at that time. Luckily, there isn't anyone ginger here, is there? My best friend was ginger, so he took a strawberry blonde, he called it. But he took a lot of flack for me, so that was cool. So it was like, he had red hair, I had red arm, and I feel like that helped me a little bit. Sorry about that, John, if you're watching this. And that leads me to another point. There will be name calling. Like, it's going to happen. It's no matter how many times we stand up here, it doesn't matter how much we do, society, it's not going to change overnight. And it doesn't matter if you have freckles, the wrong trainers, anything like that. Name calling will happen, and I think it's more about how to deal with that than saying it's never going to happen and try and get offended and insulted when it does happen, because it will. There is obviously a fine line between mates having a laugh, and even to this day, friends make jokes now and again. It's nothing serious. And then there's bullying, which is like a completely different thing. And then there is a line, I think, between there. Is name calling right? Of course not. But you know, everyone's I feel like everyone in this room, regardless of what birthmark, has been called a name at some point. Whether you've got freckles and it doesn't matter what you've got. It happens. It's a weird human trait. I don't know why we get into that, calling people names. It's a bizarre thing. But I think it's teaching your kids the difference between curiosity and cruelty, which is easier said than done, especially as a teenager. I get it. But the less you care, the less emotion you show towards a birthmark, the less others will care as well. I always got asked, and we've heard it tonight, is what's wrong with you? And I still do to this day, even at my ripe old age, I still get asked that all the time. And I never hit back with anything offensive. I just say it's a birthmark, and PAC was a birthmark, and make them feel a bit silly for questioning that or working it out. And I don't think that question, if I'm honest, comes from malice. I think it more comes from curiosity or bad etiquette, which, you know, curiosity and bad etiquette do not mix. Like, it's just a bad mix. That's always going to happen. Bullying, which is obviously very different, often comes from insecurity. I think every kid who bullies is deeply unhappy, either at home or in their life. They actually need, and this is the hard bit, I feel like they need support too. As hard as that, you know, is that to hear. Back then I was very angry with them, and I felt that, you know, that anger has now changed into, I hope that they found happiness themselves in life. We have to realise that there is more insecure than you possibly could be, and that's why they're pushing it onto you. I did, with the bullying, I did sadly resort to fighting a lot, something I really regret. But now, if you're being bullied or if you've got teenagers or whatever, the online community I didn't even know existed and didn't exist when I was a kid is incredible. Like, seeing some of the comments from these guys online and stuff like that, it actually blows my mind. Without sounding, I'm not going to do like an Oscar emotional speech, but it's really, really cool seeing that. And I think nowadays, if you're feeling down and stuff, don't go into that hole, you know, that pity side, and try and just seek out and find other people. Things like this, it's just, honestly, it's incredible. And let me stress this, I don't know if there's many teenagers here or kids, like, one day you will not care about those people. You just won't. School is like a tiny blip of your life. For this, you know, for how long we live, it's tiny. So keep strong, don't overreact. The insecure get bored as well. If they don't get the attention, they won't do it back. Push forward, get a decent education, something I didn't do. And one day, you know, you can end up being a boss, or stood here talking to them on a microphone. At school, I was really into film from day one. Even when I was a kid, my dad was a big film buff, and instead of watching films, I loved watching behind the scenes stuff, and I just got really obsessed. And I was watching the making of American Wolf in London when I was about 5, which definitely probably, I feel like that shouldn't have been allowed, but it was, yeah, I was obsessed with it. So I went, and at one point they were filming a film at the school I worked at, went to in Salisbury. And so I went to my drama teacher, and it was a time when you could do work experience. So I said, I don't want to go to, I think I was just put in a shop or something, I can't even remember what it was. Can I be in the film? And she took one look at my arm and said, I think you need to rethink what you want to do with your life. Now, if you go to YouTube and look up Walking on the Moon, ITV, and pause at exactly 1844, you'll see if I took any notice of her. And I went for it, and I'm so pleased I did, and this is, you know, this is what I mean. You just keep going, ignore the noise. As I left school, I met people and started working, things started to change. Not completely, but it got easier. I worked in a shoe shop called Shoon, and I had one moment with a lady which always stands out. It was one of those ones you have to help the older ladies in there, and their tights and their hot socks and all that. And I got a big shoehorn, and she reacted and said, "Oh my God, what are you infected with?" So I politely said, "I am infected," raised my hand directly in her face, making contact, and walked away, leaving her with that thought. I'm definitely not in any customer training videos. You know, but the customer is not always right. It was in that shop that I met Laura Kate Whitford over here. She was a private school girl. I was the complete opposite. I hadn't even got any GCSEs. So after years of her begging to be with me, I gave in. That was, you know, got there eventually, babe, well done. Being with her gave me a new confidence in myself, and after a few years of messing around, we ended up being parents and having Dylan over here. I do, who is now 17, crazy. Being a dad just wanted me to better myself, to set an example, push further and show what's possible if you don't give up, if you don't give up and just ignore the negative noise. I went back to college to get my GCSEs. As I said, school didn't go very well, not because of the birthmark, but my family life, and that's a whole different story which I'm saving for a book. Family life was on the brink of chaos and I've gone off the rails quite badly. But with support with Laura, and I went back, and that was another moment of birthmark awareness. I was 24 and dad, red arm, and I was with all kids who had just finished school. That was a crazy time and that was quite tough, but again it gave me an opportunity to normalise this. And then I joined a film production company, a film production course, and I just decided I was going to go for that dream that I've been put off for so long by that one comment. This is what people were saying when we said with doctors earlier, that one little comment can really, if you're not that, unless you're really, really strong, it can really sit with you forever. I made a couple of films, one of which did well at festivals. I started getting invites to lots of others, and at one of these I ended up sitting next to a woman called Martha Pinson. I got really drunk and showed around Poole. I'd never been to Poole. We got really lost. I don't know what I thought I was doing, but we had a great night. She said, if you ever need help with the script, give me a call. I googled her the next day, and she had been Martin Scorsese's script supervisor and Sid Lumet's for the last 20 years. So it was just a wild, chance opportunity. I met a producer at that point as well who asked me to do a film for me. He had a script and he said, I've got a script for you, do you want to look at it tomorrow, whatever. And you hear that stuff all the time, and I was like, yeah, sure, mate, whatever. I phoned him up, and surprise, surprise, didn't really remember me, and I said, oh, it's the guy with the red arm. He's like, oh, dude, the guy with the red arm. And I was like, yeah, cool. That was a really defining moment for my relationship with my birthmark. So to be remembered for that just changed everything. And that's when it kind of hit me, the power of individuality. Everyone chases it through clothes, tattoos, piercings, it doesn't matter what it is, but I had it naturally. And to stand out like that was pretty awesome. So I wrote a letter to Martin Scorsese, just outlaying the film and kind of just a bit of a suck-up thing. I was like, oh mate, you're the best ever, all this kind of stuff. I left it, I didn't really think anything of it, and then 2 weeks later I got a call from New York and flown over for him to come on as a producer. And I even got to watch Wolf of Wall Street being edited, which was just mad. And I truly believe that was all down to my being remembered because of the birthmark. Since then, I've gone on to produce a feature with Marty. I've directed some shorts. I've released a children's book called Cretaceous Crater, which is out now, by the way. I've written 2 novels which are due out with my agent at the moment. One of them talks a lot about my birthmark and my teen years growing up, because there was a lot going on there, and I've tried to really talk from someone who's got a birthmark's point of view in it. There's a lot of narration in there, so I'm really hoping that gets picked up. I've been in national radio, newspapers. I'm with an agency who are incredible, and I'm currently writing 2 feature films for them, which I still have to pinch myself that this stuff's kind of happening. During that time, I went online, I shared a topless selfie. I don't know why I ever done it. Looking back, I hate topless selfies, but I shared one, and it went, because it was a birthmark awareness day or something, and it just went viral, and I ended up on the Daily Mail and stuff, and that's when I met the birthmark support group the first time. And what I was blown away with is not the amount of people who have birthmarks, it was also how many have the same as me. I just could not believe how many got the same, which, and I felt really unique before that, and then you lot kind of moved it. It didn't stand out anymore. No, it's amazing, I'm just joking. So that was really, really cool seeing that. I just, gone through much of my life doing that, thinking I was one on, that person. And then I'd done some work alongside as well in a private school, and I met the coolest dude on the planet. His name's Frey, whose brother is here doing the photography today, which thank you very much for coming, dude. That's really cool. And that was just been the most amazing experience. But what I did notice when I went back to school again, and it's really cool going through the education, I'm learning again, it's amazing, I definitely did, was how little kids still know about birthmarks even after 30 years of leaving school, which has blown my mind a little bit. And that's when I knew I had to do this. This is why I've decided that I wanted to do this now. I could have probably done it 10 years ago. I don't think I was in the right headspace for it, but now I am, and I'm determined to make huge changes here. And with kids, you know, I get asked every single day, because you always get new kids coming, they always ask me what my birthmark is. I just tell them I'm Red Hulk. You've made me half angry just by asking. If you want to ask again, dude, I'm going full Hulk. And you know what? They laugh. And then I say, no, it's a birthmark, dude. I literally just count, it's just a birthmark, don't worry. And they're like, okay, cool. And then they go off. Suddenly their class knows, their parents knows, their family knows, and that's gone on. And that's because I believe it's the positive side of it. And I think this is how you do it. I think being funny, being open. I do not want to cover my mark myself. I don't think there'll be any change in society if we get defensive, unapproachable, and hide them. The reason why people don't know what they are is because we're not exposing them enough. To me personally, this is exactly why I joined the Birthmark support group, and I've gone on with Changing Faces as well. For me, I don't think it should be about hiding, using creams, or pretending it doesn't exist. It should be about being proud, changing perspectives, and normalising visual uniqueness. That was a long one, I had to read that one straight off. You know, my goal is to take this group into new heights. Even today with the cameras and all that kind of stuff, I want to make it more mainstream. I know this is a lovely community, and honestly, this has changed everything for me. This is the first time I've done this, but I don't want to be stuck in an echo chamber of feeling our own experiences and feeling sorry for each other. I want to expand that as much as I can. I want to challenge the consumer-created idea of beauty, and to show that looking different isn't something to hide, but something to celebrate. I think every one of us deserves to feel proud to look unique, and if nothing else, I've got some free food today. We've got some Birthmark love, and I wanted a port wine drink, but the bar's closed. That's what it is. So I just want to thank you again for coming. I hope I haven't rambled too much, but yeah, thank you. Forgot about the photo.
Okay, thank you, Dean, and for bringing the humour into the room, which is, I think, what we needed after lunch. Okay, so I don't know why you sat down, because you need to come back up. So if we welcome back Lucy, Amy, Dean, and Snoochie, going up to the front, and then I'm just going to and then I'll welcome Sam.
That's a good point. Hi guys, this is the fun bit. So for those of you that don't know me, I'm Sam. I'm the charity secretary. Just started in July, but I was involved with Birthmark support group before then. So my daughter is Queen Russell, who has a port wine stain, Floridan, port wine birthmark. That's hard for me to kind of change that. So I'm really proud to be here and love the charity. So, and thank you so much for you guys for being here. It's amazing to see you all and not see you on some kind of post on Instagram or something. See you in the flesh. So I've been asked to ask a few questions. So I'm going to start with our Amy. So the first one to Amy is. Oh, do you want to introduce me? Sorry. Sorry.
So hi.
Yeah,
how are we?
Lovely
that we're at a cricket. Is it a court? I don't know. I've never seen cricket before, but we're here. I just want to say thank you so much for having me. It's honestly a pleasure to be here. I'm Snoochie Shy. I'm a TV and radio presenter, and I have a birthmark here, and I've got like 7 dotted around all over the place. So yeah, on to Amy.
Welcome, Snoochie. Sorry about that. Okay, Amy. Do you think that things are different now than they used to be, as a reflection as to what people's views of birthmarks are?
Yes, definitely, because obviously, as I said in my speech, there was no social media back then. There was nothing for any children to aspire to be like, whereas now we've got social media, we've got other people working with brands, getting birthmarks represented on TV, modelling contracts, anything. So I do feel like it's definitely a lot more represented now than it was. So it's nice to see. And yeah, like I say, back then there wasn't anybody like that.
Yeah, absolutely.
So yeah, I think it's a positive, like going forward.
Yeah.
for children now to see more people out there, even with kids' toys, like, you know, the Aldi doll. We've all seen that. Like, it's great to see toys represented for children and things like that going forward. So it's great.
Yeah, fantastic. Lucy, what positive outcomes have you had from the community, from the work that you've done, and the output that you've had from your
I'm glad you've asked this, because I feel like my speech felt quite negative, so it's quite good to say the positives as well, because I feel like with having Lola with the Birthmark, we found this community that I really didn't know existed before having Lola, and also created my own kind of community online with parents, and my friends and family are the best and they support you whatever, but I do have this thing sometimes of you can't really get it until you get it, and to meet those people that get it, really get it, has been life-changing for me as a mum, but for Lola as well, being able to come to these events and see people and even meet Amy and all the kids and stuff, so that's been really positive. Lola's got signed with Zebedee as well, so that was really positive, and then it's kind of given me like a new bit of lease of life as a mum, she's my inspiration in a way, without trying to cheer up, and gone back and done my masters and writing about her, writing a book about her, and yeah, kind of figured out what I want to do in my life as well, so yeah, thanks to Lola. But yeah, I want to highlight that as much as my speech kind of talked a lot about that, there's been so many positives that I didn't even know in those first few weeks of being a mum were going to be possible for us. But yeah, I wouldn't change one thing that has happened to me and Lola for the world. No way.
And one for Dean, being our token man sitting here. Can you kind of talk to us a little bit from your perspective, being a man growing up? The differences, I suppose, for women, I think people put a lot on, females think about their appearance quite a lot more than men, and we worry about that more than men, and I think sometimes that's not, considered when it's, every gender that can have issues with anything. So could you give us a bit of perspective?
Yeah, absolutely. I think I don't know if it's a bit different now, but I feel like with guys it's very much like a get on with it, dust yourself off, carry on, stiff up a lip and all that, which I don't necessarily mean, it's kind of, there's a good and bad side of that. I think it's good to give you that confidence to be like, get on with it, but I do think the men have a difficulty more talking, but that goes across the board with, we've just had, suicide prevention, all that kind of stuff going on at the moment. And I think men just need to come together a little bit more. It's really cool seeing guys in here, because I didn't know whether I'd be the only person here. And yeah, I just feel like there just needs to be a little bit of change in attitude about being able to do stuff like this, speaking on stage, showing it off online, and just embracing it a bit more, rather than just thinking you've got to tuck yourself away and carry on regardless,
Absolutely. Snoochie, as we've not heard from you yet, I've got a few questions for you, if that's okay.
Yeah, all good. Fire away.
So the first one, how would you summarise growing up having a birthmark and how that affected you?
When I first, was born, obviously, when I came flying out, my mum had always told me from birth that it's where God touched you, so I was very much aware of my birthmark from young, because people outside would always say to me what's on your face, or you've got mascara run down your face, or just any of those comments, and my mum would always be like, this is where God's touched you, you're special. Or on the flip side, she would say, because this little bit's white and then this bit's darker up here, this is where me and your dad didn't mix. So, that was a cool one as well. But yeah, big amount here somewhere around. But I feel like school times was definitely hard. Growing up as a teenager, obviously, people would make comments whether or not it was Scarface or Paint Pot and stuff, and I felt that was quite difficult for me, growing up. It was just quite hard, and I think school was a hard thing anyway, as you was all saying. But I feel having friends in my life that supported me and loved me for who I was, and then also my mum always having my back was a big thing for me, and she would storm down that school as well, so shout out to my mum. And then we did go to the doctors and stuff, and then my mum had given me the option if I wanted laser, and I did look into it, but then I just decided no, I didn't want to do laser because it actually just makes me me. It's my thing, it makes me me. And then I feel like getting into media with like TV and radio, there was like another extra layer to it as well, because like not a lot of people had seen someone like me in the industry when I was getting in, so I feel like I experimented a bit with makeup, and then like as I was coming up, the makeup artist would like cover it anyway, so that was something different. And then I started feeling a little bit more self-conscious of it, so it just became normal to me to like now cover it up. And then I went on to Celebrity Get Me Out of It, which was the best thing and hardest thing in my entire life, because I was buried alive with 50,000 cockroaches, and one went up my vagina as well, so there's that. Don't know why I've told everyone that, but yeah, it's quite something. You're welcome. Don't have nightmares. But yeah, going into the show, actually, the team was very good. They was aware of my birthmark too, and they had given me the option as well. Do you want to go in and wear makeup, or do you want to just go out there like with your birthmark? And I just said, you know what, I'm just going to go out there and have my birthmark out. And I feel like being in that situation anyway was quite a crazy situation, because I grew up watching all these people on telly and I was just like surrounded by them. And yeah, coming out, the influx of messages that I got from like mums, parents and younger kids, and also the support from Birthmark support group was something that I had not really experienced too much, aside from like my mum and my friends. And to be able to help like kids just DM me on Instagram and stuff and show me pictures of their birthmarks was not only, that was quite inspiring for me actually, and I felt like that helped me again with my confidence. And since I've come out of that show, like I'm very much happy to just walk down the street with my birthmark. If someone asks questions, like we were saying, yeah, it's the birthmark, you know, it's my little mark, love it. So yeah, I feel like there's been a lot of different emotions, but I finally got to the place where I'm completely comfortable with it and confident.
It's amazing. It's very similar to my daughter as well. So for you, obviously you're very influential and in a good position to influence the teens and young adults in the world, in the country. So what advice would you offer to them, or you know, going forward, and how they can overcome difficulties you've had?
Yeah, I think the advice that I would give would be kind of touching on what you said, Dean, is that in school there are going to be people that say horrible things about you. Like it is what it is, and that's just school, unfortunately. But I think it's good if you surround yourself with people that love you, so friends and family. They can really support you with it as well. And I also think like going online, I feel like social media now is so different. So like even on TikTok, you can like search online. There's so many people out there with like birthmarks that are embracing it as well, and reaching out to those people and having those kind of communities too. And I think just like, I'm just gonna fling out what my mum said, it's where you're touched by God, whether or not you're like religious or not, or it's more like a spiritual thing. I feel like it is what makes you you, and it's something to be really, really proud of, and it's something that you should embrace too. So even though there are going to be like horrible comments out there, the main thing is loving yourself and understanding that it's just your gift.
Absolutely. Brilliant. Thank you, everybody. Okay, I think we're going to have like a few minutes in between, and then Quinn's going to come and do a performance. Do you want to?
We could stick that up there then, yeah. Just to say thank you to all of you, because actually I think one of the things that's come through for today certainly is around something that we've identified for quite a while, and it is those teenage years, and we've seen that as a common theme. And I suppose it's around that inclusivity, and how do we then start to promote, you know, the uniqueness within the school settings, beyond school settings, but within it. So, but I just want to thank every one of our ambassadors, so our 3 ambassadors, Dean, Lucy, Amy and Snoochie, for making the journey over today. But it's not over yet, so we're waiting for Quinn, but I just wanted to fill in that gap because I don't do silences very well. So, and thank you, Sam, for hosting those questions.
On that note, thank you to Quinn for everything she's done today.
We need the microphone to make the comment.
I didn't touch it.
I just wanted to make a comment. It's really interesting because we teach our children when they come with their birthmarks at the hospital. So when somebody asks you, what do you say? They say, it's my birthmark. But I'm just thinking while you guys have been talking to say, maybe we should teach our children, it's my birthmark. I'm totally gifted.
Yes.
That word, gifted, I think is very unique and very important. So I'm going to teach all my patients and children to say it's my birthmark, but I'm gifted.